Welcome to this comprehensive class member transition program policy training provided by the UIC College of Nursing. This training will provide an overview of the SSDI Outreach, Access, and Recovery SOAR model and its implementation in the comprehensive program. By the end of this session, participants will be able to describe what SOAR is, describe the steps of the SOAR process, including the development of a medical summary report, and describe how SOAR interfaces with CCMTP policies. The information provided in this training module is outlined in Policy P6.03, Serving Members with No Income. Please note that this training module presents an overview of the information provided in more detail in this policy. CCMTP program staff should read and understand each CCMTP policy in detail. The SSDI Outreach, Access, and Recovery SOAR model is designed to help states and communities increase access to SSDI for eligible adults who are experiencing or are at risk for homelessness and have a serious mental illness, medical impairment, and/or co-occurring substance use disorder. A handout describing the definition of homelessness used by SOAR and the Social Security Administration is attached to this training module. SOAR is a best practice supported by the Substance Abuse and Mental Health Services Administration, SAMHSA. SOAR is a collaborative process that guides caseworkers to collect and submit relevant information for the Social Security Administration and Disability Determination Services. Supplemental Security Income, SSI, is a needs-based program for individuals who are blind, disabled, or elderly with low income or low resources. Social Security Disability Insurance, SSDI, is for blind or disabled individuals who are insured through employee and employer contributions to the Social Security Trust Fund. In most states, Medicaid and/or Medicare health insurance accompany these benefits for those eligible. There are similarities between programs. Both programs use the same medical criteria for determining disability based on medical evidence and functional abilities, and both programs utilize the same application process and share one disability determination. The key difference between programs is the non-medical eligibility criteria. SSI is based on need. SSDI is based on contributions by employees and employers to the Social Security Trust Fund as authorized by the Federal Insurance Contributions Act, FICA. In the SOAR model, caseworkers help individuals apply for both SSI and SSDI for every application. The Social Security Administration defines disability as the inability to engage in substantial gainful activity because of medically determinable physical or mental impairments that have lasted or expected to last for a continuous period of at least 12 months or is expected to result in death. Substantial gainful activity, SGA, is a term used by SSA to describe a level of work activity and earnings. Work activity is substantial if it involves doing significant physical and/or mental activities, and is gainful if performed for pay or profit, even if profit is not realized. SSA annually sets an amount of gross monthly earnings that is considered SGA. Medically determinable physical or mental health conditions must be documented with clear evidence by an acceptable medical source, AMS. Acceptable medical sources include physicians, psychiatrists, psychologists, advanced practice nurses, physician assistants, and sometimes audiologists. The SOAR model aids the SSDI application process by providing the information SSA and DDS need to make a disability determination. We will review the standard steps of the SOAR process now. A handout describing these steps in more detail is attached to this training module. Step 1. Review any documentation available on potential applicants, including medical records, along with SSA's listing of impairments to help determine whether the applicant is potentially eligible. This list contains medical criteria that apply to the evaluation of impairments in adults aged 18 and over. If appropriate, proceed to Step 2. Step 2. Make connection with the applicant. Use the initial meeting worksheet attached to this training module. Always offer respect, choice, and control. People who are experiencing homelessness are often not offered these. Have the applicant sign agency releases for all collateral sources, for example, family members or employers. Have the applicant sign 2 release forms for each treatment provider, your agency release, and an SSA 827, authorization to disclose information to the Social Security Administration. Signing both releases provides HIPAA-compliant compound authorization, which allows you to gather records and re-release them to SSA. Complete and have the applicant sign the SSA 1696, Appointment of Representative. You will submit this form with the complete application packet in Step 9. Schedule weekly meetings with the applicant before the end of the SOAR intake meeting. Step 3. Request treatment records from 2 years prior to the onset of disability, the date the applicant last earned substantial gainful activity, and any older records that may have information supporting the onset of the applicant's symptoms. Review all records received. Confirm symptoms correspond with SSA's listing of impairments. Step 4. Establish protective filing date by initiating the online disability benefits application on the SSA's website, after which you have 60 days to complete and submit the application. Step 5. Continue to gather supporting documentation. Step 6. Complete forms and documents for the online application and paper packet. For a list of relevant SSA, SSI, and SSDI forms, visit the SOAR page on the UIC-CON Colbert-Williams website. Step 7. Complete the medical summary report, described in more detail in the next section of this module. Step 8. Complete and submit the online disability benefits application. Step 9. Submit the paper application packet. The Medical Summary Report, MSR, is a critical component to the SOAR application. It is a letter written by the case manager and submitted as part of the SOAR application packet. Several examples of MSRs related to specific conditions are attached to this training module. You are encouraged to use the SOAR Medical Summary Report template attached to this training module to help you organize information. The structure of your MSR should follow the same structure as the template. There is also a handout describing considerations for interviewing deaf and hard of hearing individuals for the MSR attached to this training module. The MSR template is organized into 8 sections. Introduction, which includes identifying information such as name, date of birth, and social security number. Personal history, which includes independent living, family history, and educational background. occupational history, substance use history, physical health, psychiatric history and treatment, functional information, and a brief summary. Remember, your goal with the MSR is to help the DDS examiner see the person. The challenge is to transform information you've collected into a vivid picture of the person and their functional abilities. Remember to directly quote the applicant wherever possible. Be sure to attach any referenced documents to your report. Avoid using opinions in the MSR. DDS examiners are looking for factual evidence based in the medical records, progress notes, quotes from your interviews, observations made, and collateral information. Avoid using your own opinions in the MSR or projections about what might happen in the future. For example, it would be inappropriate to write, "The MSR shows that this applicant is clearly disabled," because it is DDS's responsibility to make that decision. Make connections between the symptoms and functional impairments, but do not analyze or judge what that means. To avoid inserting opinions, it is often helpful to rely on direct quotes from the applicant or medical records when presenting your evidence, rather than paraphrasing what they say. At the end of the MSR, sign the report. Be sure to provide your contact information. If possible, have the MSR co-signed by a medical provider who has seen the applicant and reviewed the report. A co-signature by an acceptable medical source, AMS, raises the MSR from collateral information to medical evidence. Remember, SSA considers certain clinicians to be an AMS, including physicians, psychologists, advanced practice nurse practitioners, or physician assistants. Audiologists are also acceptable medical sources for hearing-related disorders. When asking a treating physician to co-sign your report, stress that they are not responsible for the decision that DDS makes. The SOAR article, "What Medical Providers Need to Know About SOAR," which may be helpful to provide, is attached to this training module. A well-written MSR is an essential part of the SOAR application packet, even if a co-signature is not available. If Social Security denies an application for disability benefits, the applicant may request an appeal. A toolkit for caseworkers submitting appeals using the SOAR model is attached to this training module. Be sure to inform applicants of their right to appeal. Explain the process so they understand next steps. Prime agencies should connect applicants to legal aid, pro bono attorneys, or other agencies that can assist them with their appeal. As outlined in Policy P6.03, Serving Members with No Income, once a class member is identified as having no income, the prime agency must explore available options for income applicable for the class member. This may include full or part-time employment, family support, veterans benefits, retirement benefits, pension, or Social Security income or Social Security disability income. The prime agency must identify SOAR staff that will engage class members without income and/or SOAR services when this is the most appropriate potential source of income for the class member. The primary goal for class members that are referred to the CCMTP without a source of income must be to obtain income. Therefore, there are exceptions made for the initial CSP for these class members. Please see Policy P3.01, Comprehensive Service Plan Development and Transition Planning, and Orientation Module T3.1, Service Planning, for guidance on developing an initial CSP for class members without income. There are several SOAR expectations and deliverables that prime agencies should be aware of. Pre-transition contact must be documented minimally every 30 days for any class member in the CCMTP, using the pre-transition member contact note type in the web app. Pre-transition contact for class members without income also follows these guidelines, but may be documented by SOAR staff and/or supported employment staff. The note should document progress and/or continued challenges with obtaining income, the status of any pending referrals, and efforts to obtain income each month. After at least 6 months of documented effort to obtain income and all options have been exhausted, the prime agency may request to close the class member under a new closure outcome, unable to obtain income. The prime agency should continue services and update the CSP if there are still options for the class member to obtain income in the near future. Please note, class members awaiting the outcome of active Social Security Administration benefit applications should not be closed unless a denial outcome has been received from the SSA and uploaded to the web app. Prime agencies must complete and submit a monthly dashboard tracking all class members who currently have no income. This dashboard serves multiple functions and must be completed accurately and on time. The dashboard will be due by the 5th of each month or next day if the 5th is a weekend or holiday. The dashboard will detail SOAR referrals and progress. The dashboard will identify those referred to employment services. Refer to document 6.3, SOAR Service Deliverables and Reporting, for dashboard details and instructions. Remember, class members have the right to decline transition services until a source of income is obtained. Class members also have the right to transition to a community setting without a source of income. Should class members decide to transition to a community setting without income, the prime agency must ensure that the class member is fully informed of the associated challenges and risks of living in the community without an income. Please utilize all available SOAR training resources. In addition to the attachments included with this training module, UIC-CON maintains a SOAR resource page on the UIC-CON Colbert-Williams training website, which outlines the SOAR standard process in more detail, provides guides for specific SOAR components, provides toolkits for care managers and class members, and links to resources and tools to support the implementation of the SOAR model. There are also several training videos which outline the SOAR process in more detail available online. Links shown here. Current versions of all comprehensive program policies and forms can be found in the web app library, and educational resources can be found on the Colbert-Williams training website, managed by the UIC College of Nursing. Any questions can be directed to the Colbert-Williams Help Desk, linked at the bottom of every page of the Colbert-Williams training website. Thank you for your attention and efforts to ensure safe and successful class member transitions.